Hi everyone, it's Shahira, and you're with me on another episode of the Life and Style podcast on Sinar Daily. So I hope everyone has been well and healthy. So today we'll be talking about a health topic. It's about smoking and cancer and the link between. So as you know, recently smoking and cancer has been, the topic has caused quite a bit of a stir in the political, in the realm of politics, because the Tourism and Arts and Culture Minister, Tiong King Sing, he claimed that our previous Health Minister, Jamalul, during his time in office, failed to provide proof that smoking was linked to cancer. So I want to dive a little deeper on that, and how smoking actually causes cancer and how it impacts our health in other ways. So I'm joined by a special guest today. His name is Dr. Jamalul Azizi Abdul Rahman, and he is a consultant respiratory medicine and physician at the Sultan Idris Shah Serdang Hospital, and he is a visiting consultant at Cardiovascular CVS in Kuala Lumpur. So Dr. Jamalul, he is an esteemed respiratory physician. He has accumulated a wealth of experience over his 19-year career, focusing on interventional pulmonology, pulmonary physiology, sleep medicine, and lung cancer research. Hi, Doctor. Assalamualaikum.
Salam.
How are you?
Good.
Thank you so much for joining me today. Okay, so let's just jump on the statement that I introduced the podcast with. So, just for the sake of it, Doctor, smoking and cancer has been well documented. But can you just explain how does smoking actually cause cancer cells to thrive?
All right.
Yeah.
Thank you very much, Shah and Sinar Daily for inviting me for this podcast. So the question is how smoking causes lung cancer, or how smoking causes cancer or cancer cell to thrive.
Yeah.
Okay, actually the evidence for smoking or tobacco smoking causing cancer actually is there is so much data actually on this. So so really I'm not sure why some people are still not convinced about the fact that that smoking causes cancers actually. Because the evidence, there is a large volume of data on this actually, and so what happened is we must know that in the smoke, in the cigarette smoke actually, there are actually thousands of chemicals actually, at least more than 7,000 chemicals in the tobacco smoke, and at least 250 chemicals out of these 7,000 are harmful actually. They contain things like carbon monoxide, ammonia, and 69 out of 250 chemicals in the tobacco smoke actually are carcinogens. So carcinogens, by that I mean agent that can cause cancer actually. So just imagine 69 chemicals in tobacco smoke are carcinogens, meaning they can cause cancer. So how do these 69 chemicals cause cancer? So what happens is when someone inhale tobacco smoke, what happens is obviously they also inhale this toxic agent, toxic chemicals, right? Carcinogens. So what these carcinogens do is they damage the DNA in our cells. So we know what DNA is, right? Deoxyribonucleic acid, which is a chemical inside our cells, which controls the growth and function of our cells. We have millions of cells in our body, right? So what happened is this poison or carcinogens in tobacco smoke damage the DNAs, our DNAs, all right? So when our DNA is damaged, then our body loses the the control of cell, and function of the cell,
Okay.
and that will allow the cell to grow out of control.
Okay.
And eventually, ultimately, causing cancer actually. So the association between smoking and cancer is so strong. Actually, there's no dispute about it.
All right.
Yeah.
Okay. So the top most type of cancer would be lung cancer, correct?
Yeah, not only lung cancer, but almost tobacco smoke can affect any part of the body. Actually,
Okay.
can cause lung cancer and other types of cancers.
What kind of cancer, doctor?
Well, you can imagine all from your mouth all the way down. Okay, the throat cancer, cancer of the esophagus, which is the tube bringing your food. And when you swallow your food, it goes down through the esophagus and into your stomach. So, cigarette smoke can cause cancer of the esophagus, stomach, the pancreas, the kidneys, and for a female, tobacco smoke can also cause cervical cancer.
I see.
Yeah. So almost all parts of our body can be affected by smoking, actually, by cigarette smoke, actually.
All right. But sorry, the smoking has to be like it's for heavy smokers, or like secondhand smokers also can.
Yes. Heavy smokers and secondhand smokers also can be affected. Yeah.
Okay. But okay, doctor, if smoking is one of the main risks for lung cancer, what about lung cancer for non-smokers? How do you explain that?
All right. So how do you explain that even non-smokers can develop lung cancer,
Yep.
right? So people always ask this question. So there are a few reasons why even non-smokers can get lung cancer. For instance, if they are a second-hand smoker, meaning that they are exposed to cigarette smoke from others around them. Okay, so after some time they can get they can get lung cancer. And then other factors such as air pollution, which is I think maybe beyond our control.
Yep.
Air pollution, exposure to other things like radon gas, asbestos exposure. Asbestos is the material that they use in building, actually. Yeah, so we don't know whether we are exposed to asbestos, right? Diesel exhaust, exposure to diesel exhaust also. And we are exposed to it all the time, every day. When we go to a petrol station, we don't know.
That's true.
Right? And then lastly, a genetic factor.
Okay.
If there is a family history of lung cancer, for instance, then it's difficult to avoid getting lung cancer, actually, when you have a family history, actually. So that explains why lung cancer can occur even in non-smokers. Yeah.
Okay. But what about like when you talk about male and female smokers, are they at equal risk of getting smoking-related cancer?
Yes, definitely. So people might think that female are at a lower risk of getting lung cancer. No, as long as they smoke, they are, male and female, they are at equal risk of, getting lung cancer. Because, as I said, there are thousands of chemicals in the tobacco smoke, and many of them are carcinogen. Of course, so either whether you are a male or a female,
it doesn't matter.
So it doesn't matter. You inhale the cigarette smoke, you inhale the carcinogens, you could get cancer, actually.
Okay. Doctor, before I go to the next question, I'm a bit curious. Like, does it take a smoker like a long while, like a few years, and before the possibility of the cancer cells to thrive, or is it like you smoke for a few months and the risk is there already?
Yeah. Right. So cigarette smoke doesn't cause lung cancer overnight.
Yeah.
obviously. So the process of damage to your DNA inside the cell, that takes many years actually. So normally people develop lung cancer after say 10 years of smoking. Yeah, so it doesn't occur overnight. Actually.
Okay. So what percentage of smokers actually get lung cancer, if you can share with us?
Right, so that's an interesting question. Because not every smoker gets lung cancer.
Okay.
All right, that is always the argument made by smokers. They claim that my father or my late grandfather used to smoke a lot, but they never got lung cancer. So it's true that not every smoker gets lung cancer. Okay, so it's about 20%. Only about 20% of smokers actually get lung cancer.
Okay.
So you might ask why? Why the other 80% don't get lung cancer even though they smoke heavily, right? So the answer is because certain individuals are protected by their genetics.
I see.
So so these people are fortunate. They are protected from getting lung cancer by their genetics. Then they don't get lung cancer. Then they are happy to smoke, forever actually. And this is always an argument that I face. Whenever when I talk to smokers, actually, and it's always difficult, to convince them because they say, not only it is my right, but I don't have any family history of lung cancer, and I've been smoking for many years, and I'm still well. So that explains. Yes, you are fortunate to be protected by your genetics. That's good.
You're protected, but at the same time, you're kind of risking others.
That's correct.
Well.
Although you are protected by your genetics, but you may cause harm
to other
the people around you. Actually,
that's true. Okay, but what about doctor? What about like people getting screened for lung cancer or like cancer in general, or like are people getting screened enough?
Yeah, that's very that's very interesting question actually. Actually, there is a method to screen for lung cancer.
Okay.
All right, and so it's already being implemented in many developed countries like USA, in the UK, and and over there actually maybe the awareness is very very high. A lot of people get screened for lung cancer.
Okay.
And the method used is what we call low-dose CT scan. Low-dose CT scan. So, it's not the usual CT scan.
Okay.
As the name implies, low dose, you give low radiation just to pick up, anything that might suggest lung cancer in your lung. All right. So this low dose CT scan method has been proven based on the studies. Has been proven to reduce death from lung cancer actually in the US and in the UK. And what they do, I know, in the UK is they go to remote areas, in the countries, they bring mobile CT scanners, Yes.
Really?
Yes.
Oh.
That's how they can pick up a lot of early stage lung cancer. Unfortunately, we haven't reached that stage yet.
Here in Malaysia.
You see, and that's why the survival from lung cancer is very good in the US and the UK, and compared to Malaysia. You see, so so that's the scenario in the US and the UK with regard to screening for lung cancer. In Malaysia, what's the scenario? Well, a few years ago, I personally was involved in a small project to screen for lung cancer using low dose CT scan. Okay, but unfortunately, despite all our efforts, to promote this screening test, the response from the public was very poor. Okay, very poor. See, and we were providing low-dose CT scan for free.
Where?
In KL, no, in certain selected hospital, in certain selected government hospital, mainly in Klang Valley, I think, and one of the hospital is my hospital, Sultan Idris Shah Serdang. The other hospital is Institute Cancer Negara in Putrajaya.
Okay.
So these are the two main centers offering free low-dose CT scan.
Wow. When was this, doctor?
Sorry?
When was this?
A few years ago, actually. I think it's about 4 or 5 years ago.
I see.
And unfortunately, the public didn't come to us, despite the free service that we were offering, And so ultimately, we had to terminate the service.
How long did that last? The free screening. How long did it?
About 2 years. We were waiting. Yeah.
Why do you think people weren't coming?
Okay.
Though?
Again. Good, interesting question. Why? Why is our public, is not so responsive to this screening for method to detect early lung cancer? So a few reasons. Maybe just lack of awareness, okay, and some of them may simply refuse, to be screened actually, and maybe they're afraid if they get screened,
they'll find out.
They find out there is something there is lung cancer, and then they need to undergo a procedure to confirm, the diagnosis, we call it biopsy, putting a needle to the lung, to get to the cancer. Okay, so a few reasons. So, personally, I feel sad that the response was poor. And
this is in like Klang Valley area. It's not like it's out,
Yeah. Actually, there were a few other selected hospital outside Klang Valley that were involved in this.
Equally not responsive.
Yes, that's right.
That's sad.
Yeah. So I don't know what else can be done actually to convince our public actually, maybe one suggestion is to bring this mobile CT scanner to the remote areas, of the country, like the villages, maybe make it easier for the public to get screened, but we need some commitment actually from the government actually to do that actually. And so currently the fact is, we are not providing screening for lung cancer in government hospital
right now. Currently,
right now, no.
The low dose CT scan,
no,
no, there's not.
So it's only available in most private hospital actually. What I can see is the patients in going to private hospital, they are more aware actually of lung cancer actually, and the private hospital, most private hospitals do provide a screening for lung cancer.
Okay, with this through the low dose CT scan.
That's right. So they can pick up lung cancer at very early stage actually.
I see.
Yeah.
Is the reason it's not available in government hospital is because people
the response
are not
was
going
so
to
poor.
it or not? Oh, so it just decided to stop.
Yes.
Oh wow.
Yes. Because no choice. We can't offer the service when there are no patient coming to us.
Yeah. I have to ask, is it expensive to get screened?
No, of course. In government hospital, it's almost free.
Yeah. Exactly, right? But for a private, it's a different story lah.
Yeah.
Right. Okay.
In private hospital, they have to pay.
Yeah. Correct. Sorry. What is the process, doctor, to get screened? Like, what does the patient have to do?
They just have to come to the hospital and then get to be seen by a doctor who will assess the the risk for lung cancer, and if the patient, meets the criteria, then the doctor will order, a low dose CT scan actually.
I see.
Yeah.
I see. Okay. Wow, that's interesting. So because just now you mentioned about the survival rates is higher in the UK compared to Malaysia, right? So what is the survival rate of a patient with lung cancer caused by smoking?
Okay, so the survival rates of lung cancer depend on the stage actually. So we have stage 1, 2, 3, or 4. So stage 1 is the early stage, and stage 4 is the advanced stage, All right. So the problem is more than 90% of patients with lung cancer in Malaysia come at a very advanced stage.
Stage
actually,
4.
Yeah, stage 4 actually, So so when they come at either stage 3 or stage 4, the survival is less than 6 months from the time of diagnosis.
Really?
Yeah.
Less than 6 months.
Yes. So it's very poor actually, And if you're talking about 5-year survival rate, meaning how many of them can survive for at least 5 years from the time of diagnosis, right? Even our data, the Malaysian data, is not encouraging. You see, when I check the data in Malaysia, for stage 1, the 5-year survival rate is only 37%, meaning only 37% of patients with lung cancer at stage 1 will still survive at 5 years.
5 years.
Whereas in developed countries, the survival rate, the 5-year survival rate for stage 1 is more than 80% actually.
Because they got screened earlier, or is that why?
Yeah.
Okay.
Or maybe, I think it's because of, maybe, I don't know, maybe, so-called stage 1 in Malaysia may have been, understage actually, meaning, instead, maybe the patient actually doesn't have stage 1 actually, maybe it's stage 2 or 3 actually, So and then, talking about stage 4, the advanced stage in Malaysia, a 5-year survival rate is only 6.3%. So, but 6% of these patients are still alive at 5 years. So it's very poor, actually, And the reason is because they come late. The problem with lung cancer is that at early stage, for example, stage 1, they don't have any symptoms. Okay, and that's why they don't come
know
to us. So when they have symptoms like cough, coughing blood, it's already stage 4.
Wow.
Yeah.
Okay.
So that's the fact about the lung cancer actually. Okay. And in my practice, I think it's the same everywhere. In Malaysia, most of these patients come when they have symptoms, like they have chronic cough.
What other symptoms, doctor? Like, can you share?
Cough for a long time, for more than a month. Coughing blood.
Coughing blood.
And then difficulty in breathing. So most of the time we see this kind of patients, and we are able to make the diagnosis. But they don't live for more than 1 year actually. Many of these patients actually. And despite being given chemotherapy, radiotherapy, so that's the sad fact actually about lung cancer in Malaysia. Actually,
But doctor, in that stage 4, right? Is it mostly like the age? Is it like older or is it younger people?
Not really.
Doesn't matter.
Not really. Nowadays, even females, young females can get lung cancer actually. That's the scenario we see here in Malaysia actually. They never smoke cigarette. They are young. They are female, but they get lung cancer. And they come in late as well. Stage 4, actually.
Okay.
Yeah.
Okay. So it's caused by several factors that you mentioned just now, lah. Okay.
That's
Okay.
right.
All right. So okay, Doctor, let's just move on a little bit about how smoking is also one of the leading causes of chronic obstructive pulmonary disease. Can you elaborate more on what that is?
Right. So,
Yeah.
chronic obstructive pulmonary disease, or COPD, is a condition where, the lungs and the lung tissue get damaged due to smoking for many years. All right. So, what happened in chronic obstructive pulmonary disease? The airway become narrowed. Okay, and the lung tissue also get damaged. Actually,
Okay.
So, when this happens, so the patient will have difficulty in breathing actually, and have cough with a lot of phlegm. Okay, and so the symptoms are almost like asthma actually. Other symptom is like wheezing, for instance. But in asthma, the difference is in asthma is not usually associated with smoking actually.
Oh.
All right.
Okay.
But in COPD, it is always associated with smoking.
Okay.
Yeah.
Okay.
Yeah.
Okay. Does it affect any age in particular, like mostly?
Yeah, usually anyone who is 40 years old and above actually.
I see.
After you see the effect of smoking for many years. Most of them smoke during since their teenage years. Okay, and after 20 years, they see the effect, the harmful effect to the lung actually.
Okay. So, Doctor, I besides cigarettes, I also want to talk about vapes and e-cigarettes. And I think I see there is an increased use of e-cigarettes and vapes among the younger generation, teenagers. And what can you share with us, like the effects of e-cigarettes and vapes as compared to normal cigarettes?
All right. So we must know that e-cigarettes and vape, they contain highly concentrated liquid nicotine. All right, and the effect. Okay, so the most serious effect of e-cigarette and vape is a condition called EVALI. EVALI,
Okay.
which stand for e-cigarette and vaping product use associated lung injury.
Oh, okay.
So this is like an acute or subacute respiratory illness that can be very severe and life-threatening, meaning it can kill you actually. Okay? And so people might think that e-cigarette and vape are safer than cigarette, right? Because they don't have this e-cigarette and vape do not have toxic chemical. E-cigarette and vape do contain potentially toxic chemical. Okay, but they're probably the content are probably less than tobacco smoke actually. Like in tobacco there are more than 7,000 chemical, right? So the contents are less in e-cigarette and vape actually. Okay, and although e-cigarette and vape do not have more carcinogen like tar and carbon monoxide actually. So so this is the long-term effect of e-cigarette and vape actually, EVALI actually, and it will cause damage to the lung actually.
I see.
Yeah.
But do they cause cancer? Vapes and e-cigarettes, do they cause cancer?
Right. Okay. Interesting question again. Okay. So vapes and e-cigarette, do they cause cancer? All right. As I said, vapes and e-cigarette contain highly concentrated liquid nicotine, right? And okay, we're talking about evidence. Okay. So far, all we can say is the effect on the the incidence of lung cancer is not well established. So really, we can't be sure at this stage whether vape and e-cigarette can cause lung cancer. The reason is because many of these youngsters who take vapes and e-cigarette, they also smoke cigarette. So we don't know. So there might be a confounding factor of cigarette smoke. So if they get lung cancer, we don't know whether it's due to vape or cigarette smoke, because they take both actually.
Right.
So we don't know. So what I can say is the evidence that is still not there yet to associate vape and e-cigarette with lung cancer.
Okay. So just jumping on that, what about nicotine poisoning?
Okay.
Can you talk about that? What is that?
Okay. As I said, this is what is inside e-cigarette and vape actually. So this highly concentrated liquid nicotine actually can cause really life-threatening toxicity and death actually.
Okay.
And the symptom can range from mild, moderate to severe actually. This nicotine poisoning. All right. So mild symptoms of nicotine poisoning are like nausea, vomiting, drowsiness, rapid heart rate actually,
Oh, I see.
Yeah, so it can cause rapid heart rate, which is not good for the heart. And then moderate symptoms of nicotine poisoning are like they can cause high blood pressure, and wheezing and hand tremors, the hands start shaking, actually, and severe ones due to nicotine poisoning include even the cardiac arrest actually, and patient go into coma and become unconscious actually.
Really?
Yeah.
I see. Okay, wait, can you get nicotine poisoning from normal cigarettes?
From normal, not that I'm aware of actually, because I think the concentration is not as much as not as much as in e-cigarette and
vapes. Okay. But okay, doctor, why do you think the youngsters are more inclined towards trying these e-cigarettes and vapes? Why do you think so? Is it because of the flavors? Why do you think so?
Okay. Why are teenagers so keen on e-cigarette and vaping, right? Okay. I don't know myself actually now because I've never tried e-cigarette or vape myself. Okay, but I suspect. Okay, I suspect maybe these young people think that vaping is less harmful than smoking because as I said, in the tobacco smoke there are more than 7,000 chemicals, right? So in vape and e-cigarette there are fewer chemicals actually. So maybe they think that it is safer. Yeah.
Okay.
And I don't know whether it is cheaper than tobacco than cigarette. I don't know. You have to check. Because I never try. I can never purchase. I'm not quite sure. But it is said that e-cigarette and vape are cheaper than cigarette. So you have to check that.
Okay.
All right.
All right.
And maybe the lack of smoke. In e-cigarette and vaping is appealing to these teenagers actually.
Younger generation.
They smoke cigarette, see smoke.
Yeah.
Okay, but if they take e-cigarette or vape, there is no smoke actually. So I don't know. And then as you said, flavors. Maybe Okay?
That's what attracts them, perhaps.
That's right. So maybe the flavors, so it tastes better than tobacco. Actually,
Yes. Okay. All right. Okay. Before we come to an end soon, doctor, I want to ask, Malaysia, they take a firm stance on tobacco control by enforcing penalties or punishment lah. So do you think, but somehow that's still being sort of ignored? People are still maybe smoking in non-prohibited areas and non-smoking areas, and they're still smoking in sort of maybe restaurants that are not allowed. So do you think that we could actually maybe change this and make it into a more positive outcome if we switch it to more like an educational approach instead of like punishment or penalties?
Firstly, I agree that enforcement is very lax in Malaysia when it comes to, smoking ban actually in restaurants, in other public places actually. Unfortunately, we have the law, but the enforcement is not there. Okay, I don't know why, but I think that we can take both approaches, punishment and educational approach actually. That's my personal opinion. I think we have to be more strict. The enforcement officers must do their work actually. I feel, and penalize those who flout the laws, with regard to smoking, in restaurants, in public places. I think the enforcement officers must be strict actually. And at the same time, the other approach, educational approach, is also good. To nip the problem in the bud actually. So really have to educate, especially the young, the young generation actually, about the harmful effect of smoking and e-cigarettes.
Doctor, I have to ask, there are smoking cessation clinics, right, in Malaysia?
Yeah.
Are they effective, in your opinion? These smoking clinics to sort of like educate people about smoking. Do you think it's an effective approach to sort of reduce the prevalence of smoking?
I think it's only effective if the smokers are really motivated to quit smoking actually.
Okay.
It doesn't work if there is no motivation actually. It won't work.
You have to help yourself.
Yes, just imagine. For us Muslims, we can control ourselves during the fasting month actually, during Ramadan actually, and during buka puasa, sometimes the first thing that they will do is to smoke actually. So I think the mental strength is very important.
Willpower.
Actually. The willpower must be there actually. So certainly, the quit smoking clinics have managed to help smokers quit smoking, but it only helps if there is strong willpower actually.
From the smoker.
From the smokers, yeah.
Okay.
Otherwise, it won't work actually.
That's right. Okay, Doctor, lastly, what can be further done to reduce the prevalence of smoking in Malaysia? What can you...
Right.
Yeah, what can you suggest?
I think we have to be realistic. I think we won't be able to eliminate smoking altogether in Malaysia, Okay, we can only try to reduce the prevalence actually, Okay, if you look at some developed countries like Australia, for instance, where the prevalence of smoking is low actually, So when I was working there before, actually many years ago, actually, okay, I still saw lung cancer, okay, even though the prevalence of smoking is low in Australia, okay. So and in Malaysia, the fact is, 50% of our adult male are smokers, and half of our adult males are smokers. That's very high actually. Okay.
You're talking about Malaysia, right?
In Malaysia, in Malaysia, half of our males are smokers. All right. So I guess what can be done to reduce the prevalence instead of trying to eliminate smoking, because there will always be smokers, because maybe they think they are immune to to certain diseases like lung cancer, because they can argue that not everybody who smoke get lung cancer. Yeah, like I said before.
That's true.
So there will always be smokers. what we can do is to try to reduce
prevalence.
the prevalence of smoking in Malaysia. I think certainly education, especially primary school level, I think, because these young people, we can easily, shape their mind actually, about the harmful effect of smoking,
Okay.
From my experience, it's very difficult to convince, convince these young people when they have reached their teenage level actually.
Yeah,
When
it's harder.
it's harder actually. So they are not so convinced at that stage when they are already addicted to smoking. They won't listen to you actually.
Yeah.
So education at primary school, I think, is very important actually. And then of course offering help to those who want to quit smoking, obviously, and then smoke-free policies, which are already in place, but it's not really being enforced actually. So we see compound 500 ringgit or whatever there, but people still smoke
Still smoking,
in those
right?
areas actually.
Yeah.
So the enforcement there is, and the enforcement is not
It's
there.
not
actually.
there.
Then I guess I don't know whether it's, the cigarette price have been increased. Maybe there's another
I think it has been increased, yeah.
method actually underway.
Yeah.
To discourage people from smoking. Actually.
Yeah. Okay. All right. Okay. Thank you so much, Doctor. I mean, do you have any, lastly, advice for Malaysians who on smoking and cancer? Maybe you can, give some word of advice and getting screened more, but maybe perhaps.
Yeah, I think my message to to the public is, if you think you have a risk factor to get lung cancer, okay, please see your nearest doctor, and to get screening done actually using low dose CT scan. I think, if you are a heavy smoker, or you are an ex-heavy smoker, you might be at risk of getting lung cancer, even though you don't have any symptoms actually. So that's my advice to the public actually. Please get screening done using low dose CT scan, and ask your doctor for advice where to get the screening done actually.
Okay. All right. Okay. Thank you so much, Doctor, for your time.
You're welcome.
For educating us on smoking and cancer. So you heard it from our doctor himself. Hopefully this gives you a more sort of like an idea or knowledge on how smoking causes cancer. So thank you, Doctor.
You're welcome.
That's it from me today. So don't forget to follow us on all of our social media platforms, and I'll see you guys again soon.